think we're all here, are we not? All ready? Ready. It was less than a year ago that the Supreme Court decided to threaten the right of choice in the United States. Since that time, we know that there are forces abroad in our land that are attempting to restrict that right in every way possible. And people need to know that the state of Washington is, and will always stand up for the right of choice in our state. And today we are announcing some major actions to protect this important right for the residents of the state of Washington. We wish this was not the case, but we have to recognize that there are forces abroad in legislatures, in courts, across the United States to try to take this right away from the women of the state of Washington, and that will not stand. So we are going to express a united voice today about actions we're taking to protect that emergency or that emerging national conspiracy that exists to try to take this right away from Washington women. We are defending this right every day in every way, and the first thing I will talk about today is to make sure that we maintain the ability to have access to mifepristone in the state of Washington. We know that this is a safe drug. It has been available for over 2 decades. It has been in customary use, and it has served its purpose to protect the health and a woman's right of choice in the state of Washington. Despite that, there is a real threat that a Trump-appointed judge in Texas could take action which could jeopardize the ability of Washington women to have access to this safe drug. That decision by a court could effectively end the manufacturing and availability of that drug for manufacturers. So we are not sitting idly by while that threat exists. We recognize in Washington that the price of a woman's freedom of choice is eternal vigilance. And our vigilance has led us to take actions that I will talk about today to maintain access for Washington women to this important drug. So in order to address this emergent attack and access to effective health care, I have directed our State Department of Corrections to purchase a 3-year supply of mifepristone. It's about 30,000 doses. The department is able to make this purchase using existing statutory authority. The purchase has been made, the shipment has arrived, it is in our possession, and the department is appropriately maintaining that safe supply. This acquisition of a 3-year supply was step 1 in our effort, but it is only a step 1. Step 2 is to authorize the department to distribute this medication to healthcare facilities and healthcare providers. To achieve step 2, I've asked our friends in the legislature to authorize this, and we will have Senator Kaiser and Representative Bateman address that issue today moving forward. To be clear, the authority we are seeking today is limited to abortion medication and does not extend to any other type of medication. Washington State will not allow a judge in Texas to deny the right of Washington women to this safe drug. We will not sit idly by. We have to recognize these threats will continue, and our actions will continue to preserve the right of choice in the state of Washington. With that, I'd like to Senator Kaiser and Representative Bateman to address this issue.
I want to thank the governor and his staff. We've been working for the last several days on being able to go forward with this proposal. I was happy this morning to drop a bill. It is Senate Bill 5768. It will be referred directly to the Ways and Means Committee. And this bill will authorize the Department of Corrections, and I'll read the exact title of the bill, to protecting access to abortion medications by authorizing the Department of Corrections to acquire, sell, deliver, distribute, and dispense abortion medications. And you can read that for yourself online. Abortion rights and reproductive freedom means nothing without access. And if patients don't have access, they might as well not have a legal right. The extremist federal judge that is likely to rule that the FDA process was in error on mifepristone is something that boggles my mind how these federal judges get to the point where they can rule for the whole nation is beyond me. But we can take creative solutions to deal with this kind of judicial activism. Washingtonians have affirmed at the ballot box a couple of times, and in statute many times, that we believe in reproductive freedom for all in our state. And we're going to make sure that our healthcare providers have the right tools and the right medications to deal with the residents of our state's needs for reproductive care. And that's what I believe we can ensure with passage of Senate Bill 5768. Now, Representative Bateman, who is my co-conspirator.
Thank you, Senator. Thank you, everyone, for being here today. I'd also like to reiterate my gratitude for the governor, the attorney general who's here today, my colleagues in the House, and my colleagues in the Senate for taking seriously the reproductive health rights of all Washingtonians. The Dobbs decision last June changed everything. By overturning abortion protections at the federal level, the Supreme Court put in jeopardy reproductive choice across our country. Washington did not stand idly by. We immediately took action. In the 2023 session, we have worked to make sure that doctors can continue to provide safe and legal abortions by protecting providers from facing legal consequences from other states. We've also worked to ensure and keep access to abortion affordable by eliminating copayments or deductible requirements for accessing abortion care. And we've worked to protect healthcare data, which is especially important for reproductive health care, by making violations of the My Health, My Data Act punishable by the Consumer Protection Act. And in Washington, by taking this step today, we will ensure that Washingtonians can continue to access medication for abortion. We know that abortion is health care, and we believe that every person has the right to access abortion, access the full spectrum of the reproductive health choices, and have their own right to their own bodily autonomy. And we know in Washington that healthcare decisions should be made by a patient and their provider, not by a judge in Texas. Thank you very much for being here today.
Thank you. I know many people have been working on this. I want to thank Representative Mylyn Tai for her leadership as well. Thank you very much. I know others will join in this effort. We have also asked the University of Washington to purchase a supply of this medication, and have happily obliged with an additional 10,000 doses, which they now also have in their supply. So between the state and the University of Washington, we have about 4 years backup of mifepristone. Thank you to the Huskies. This is a team effort. I want to thank our excellent Attorney General Bob Ferguson, who has led 16 other states currently in an action in federal court to remove some of the unnecessary barriers that would prevent access or reduce access to this drug, and they're engaged in this national federal litigation. Bob has been a supremely effective Attorney General in this fight, and I look forward to his continued efforts and look forward to his comments. Bob.
Thank you so much, Governor. And I know I speak on behalf of Washingtonians and everybody here, appreciating your leadership on this important issue, and our legislative leaders. Thanks to all of you for your work on this important legislation. I'll be very brief. The governor mentioned a lawsuit that we filed here in the Eastern District of Washington in federal court. Think of it as sort of the opposite of what's going on in Texas. In Texas, anti-abortion activists are seeking, as has been mentioned, to ban mifepristone, not just in states where abortion is illegal, but even in states like Washington, where abortion is safe and legal. So they're seeking a nationwide ban on mifepristone, which is used in more than half of abortions. It's very, very common medication. It's been my feeling since the Dobbs decision came out that anti-abortion activists will not be satisfied with that decision. They will stop at nothing until they have removed every last vestige of reproductive freedom for Americans across the country, including individuals who live in states where abortion is safe and legal. And with that in mind, we have filed a lawsuit here to expand access to mifepristone. In a very short summary, mifepristone is one of only a few dozen drugs that have restrictions on its availability. So the FDA has made thousands and thousands of of medications available without restrictions. About 60 have restrictions, like fentanyl, highly dangerous drugs. Viagra has no restrictions. Mifepristone, as noted, safer than Tylenol, has restrictions. Pharmacies have to go through a special certification process, for example, in order to dispense it. It's our view that those restrictions are unlawful and unnecessary, which brings us to our lawsuit that we were in federal court last week. 17 states have joined us. So again, we're seeking to expand access to mifepristone for Washington and those other plaintiff states. Kristen Beneski, who's here, argued that case last week. She's available afterwards if you have questions about that case specifically. But it's an important case, and we felt the hearing went well. And you know, our job, I think all of us collectively have made it clear that you know, the attacks on reproductive freedom are, you know, there are really not real words to capture it. Those attacks will continue, and so we need to do what we can as leaders of our state to make sure that the people of our state have the full range of reproductive freedoms. If that means adding thousands of this medication to make it accessible, that's important. If that means filing a lawsuit against the FDA to expand access, that's important, and we're going to continue taking these actions to make sure that Washingtonians have the health care that they need and that they want and that they deserve. Thank you very much.
By the way, we have Senator Monka Dinger, who's been a leader in this effort. Thank you for your leadership. I just want to note, Bob is leading 17 other states. This is very typical for Washington State under his leadership to lead other states that have joined us in these multi-state lawsuits. It's just another case. He's doing a great job for the state of Washington. You know, we were the first state to do this, to take this action. And this is consistent because we were our value system in the state of Washington. We value a woman's right of choice, and we were the first state in the United States to actually embed this by popular vote of the people at the ballot box. So it's appropriate that we are the first to take this action to protect access to a woman's right of choice, and we will continue in this. I want to note, too, that this is just one of the many attacks that we are suffering from people who want to strip this freedom of choice from women across the United States. And we have to understand they will come at us in multiple different ways. Now we are experiencing an effort for the anti-choice coalition to reach its tentacles into our state, and that will continue, including efforts to prevent people from traveling across state boundaries. This is something we've always enjoyed as Americans, to be able to travel from state to state. And we have to recognize that there is going to be a concerted effort to prevent women from being able to cross state lines, something they've always been able to do under the American Constitution. Unfortunately, I have to report that we currently are under assault from the anti-choice forces in Idaho, where a law is now pending, waiting the governor's action that would diminish the ability of people to cross state lines. They want to make it a crime that would affect Washington residents who happen to go into Idaho for any length of time. I'm deeply concerned about the impacts this law would have on Washington residents and Idaho residents. We have helped Idaho residents during the COVID emergency and treated them in our hospitals, and we now want to protect a woman's right to travel to Idaho without fear of repercussions and return safely. And we also care about Idaho women, too, who we are now treating and will continue to do so. This bill would damage that right to travel. It is a grave danger. Accordingly, this morning I'm sending a letter to the governor of Idaho, urging him to veto that law, not allow this attack on a woman's right to travel in the United States to continue. We believe there is a constitutional right to travel for Americans across state lines. And this nation should not be balkanized by one state preventing any citizen of one state from traveling to another state under these conditions. And that right is under attack today from Idaho, and we assume other states will follow. So we think it is a gross abuse of this right to travel, and we will continue to take actions to guard against that. I do want to note that these are not the only two actions we're taking. We also have a shield law Representative Drew Hansen is leading that will shield Washington women from attacks trying to use the Washington judicial system to steal this right. And we look forward to that bill getting to my desk. We're also moving forward to protect a woman's right of privacy so that people don't use databases to be able to take away that right of privacy. So big action today. This is very Washingtonian action, and we will continue those efforts. With that, stand for your questions.
Governor, given what you just said about Idaho, can you talk a little bit more about what you might be thinking about or trying to do to protect people from, or protect the right to travel to and from to get abortion, possibly, have access to this drug now or top priority in Washington?
Well, we will take any and all actions that are consistent with our Constitution to stop this intrusion of Washington women's rights. And we have to be creative in doing that, because this is like tentacles coming at us from every different direction. They want to take away mifepristone. They want to prevent people from being able to travel across state lines. And this, you're going to see this. This is the opening salvo of an attack on women across the United States. So we will look at every measure. Today, the action we're taking is, first off, stockpile the medication so we have it available. Second, I have written the governor of Idaho, urged him to veto this wrong-headed law. It's too early to discuss potential litigation. He hasn't even signed the bill yet, but obviously that could be a potential route, but that remains to be seen. And we're urging, people across the country to understand we are going to be under attack from these anti-choice states. And so one of the things we're doing is blowing the bugle. All of us are going to have to be allied in this effort of eternal vigilance.
Governor, you need the bill to authorize and distribute the drug. Beyond that, does the state have a network or an infrastructure to receive the information from providers, et cetera, and do that? Or is that something that needs to be built?
Yes, we will be distributing this. The plan is to health clinics across the state of Washington. We have the mechanisms for doing that. That's not a problem. We just need a bill to make sure that there's no question about the statutory authority of Department of Corrections to actually distribute that product through that mechanism. So we will be confident in our ability to do this.
So to be clear, so the 30,000 doses will remain in possession of the Department of Corrections or the Department of Health?
Corrections. But we need authority to distribute it through this mechanism.
Should there be consequences for these clinics and healthcare providers in the event that they distribute the abortion pill and then the judge in Texas revokes? What happens then if those providers leave our state? Are they at risk? Is there some sort of legal jeopardy or concern?
We hope that is not the case, but we were ahead of the judge in this. That's why we did this. We have the product. It's legal. We took it legally. The judge has not barred our ability to do that. The judge is attempting to stop the manufacture of this product. Well, we have the drug. It's been manufactured. So we have that. Whether there would be some effort to unroll it, we don't know. But as of the moment, this is a legal product, and we would start to distribute it as soon as we get this bill to my desk, which I assume would be quickly. So whether there's a stay of any potential decision he makes, we don't know, but we think this is the right approach.
Governor, if all of this is planned and how would these pills actually be distributed locally? Walk us through the process if I was an abortion seeker looking to go to a care provider.
So at the moment, the plan is, and that's of course could change, but the plan is to distribute this through health clinics. And so you would find a health clinic, a health care provider, and they could distribute, the product would go to you, subject to a prescription authority. And not that much different from a different way to get it. But it needs to go through the Department of Corrections because of the unique prescribing authority that they have under existing law, which they already have. So they are entirely legal to acquire the product today, consistent with state and federal law. We need this to be able to distribute this in an easy fashion to patients.
So if I was a care provider, then I would just reach out to the DOC and then request.
Well, you might actually, your first call goes to your clinic, wherever you could get your call, and then it is distributed.
Governor, what is the cost of this purchase, and is there an expiration date? How long?
I have that answer. If someone wants to hand me my fact sheet.
$1,275,000.
$1,275,000. according to Senator Kaiser. I've got a fact sheet. If somebody can hand me my fact sheet, please.
Yep, that's what it says.
Yeah.
And how long is the supply expected to last? Is there an expiration date?
So we think about 4 years supply between the Department of Corrections and the University of Washington. With
Quality, like, sometimes
oh, I haven't been alerted that there's any shelf life issue on this at the moment.
How does the supply compare to the demand? So if you're going to look at how often medical abortions are happening in our state, how far does that?
So we purchased 30,000 pills. There's an additional 10,000 at the University of Washington. We paid $1.275. The cost is $42.50 per pill. And so our assumption at existing levels of usage, that would last for 4 years, at existing level of usage. Now, that usage could go up, but we think this was a reasonable thing to do, to stockpile this amount.
And the 1.275 is the cost just that the state is spending? That's
Correct.
not how much UW is paying?
Correct.
Okay, and can you talk a little bit about the reasoning behind the number of doses? I mean, why a 3-4 year supply? Why was that the target?
Well, for one reason, in some sense, litigation may take that long to clarify this situation to some degree. So we think it is a reasonable time period, a cushion for us, and we'll move forward from there.
Governor, do you know if other states are stockpiling as well?
So I'm told we are unaware of any other state taking this position. There may be others, it's possible, but we are unaware of any taking this position.
Governor, at this point, it's still legal, so clinics can operate and buy, so you may not need this to tap into the supply right away, right? Is that your anticipation?
That's possible, and if the judge made a different decision, we may not need it. But this is an insurance policy that is a very important insurance policy, and knowing the predilections of Trump-appointed judges, we are seeing time and time and time ago Trump-appointed judges are disrespecting women's right of choice. So better be prepared.
It's my understanding that
Just one more second, let me get Jerry. I'll be right to you.
Could the Attorney General comment on your lawsuit and the one in Texas, and how those two interplay, and whether the U.S. Supreme Court is ultimately where it should be, because it would seem the issue of legality may be months, not days, away from being resolved.
Sure. I mean, there's no short or easy, obviously, Jerry, on that. So I guess what I would say is that at a high level, obviously you have two different federal lawsuits in two different jurisdictions. And so the potential is there for two decisions from those judges that are, in effect, contrary to one another. In other words, one judge in Texas could potentially say, hey, I'm issuing a ban on mifepristone nationwide, and a judge in Washington State on behalf, in a case with 17 other states, right, saying, no, not only is it available, you've got to expand access to it. And so a lot depends on how those orders are written, of course, as you might imagine. But I think it's fair to say there is a possibility where you would have essentially two sets of rights in terms of access to mifepristone. That potential is there. In the plaintiff states in our case, if the judge goes our way, they would have not just access but increased access, and potentially if the Texas judge issues a different ruling in those remaining states, those individuals may not have access at all. You know, what happens from there, appeals and potentially to the U.S. Supreme Court, that's all potential, but that's frankly, to the judges, or to the governor's point, that could be a ways down the road before those issues ultimately get resolved in the federal court system. So it's premature to say. We're focused on our litigation. We feel we have good arguments on this one, but it's a little tough to speculate too much on how this might play out. But the potential is there for two different rulings that essentially compete against each other. That is fair to say.
Attorney General, you also mentioned a potential lawsuit against the FDA. Can you expand on that a little bit more? Maybe a timeline should that decision come down?
Yep, so that's our lawsuit. The lawsuit that we filed in the Eastern District, sorry if I wasn't clear. So the lawsuit that we filed, in which 17 states have joined us, is a lawsuit we filed in Spokane in federal court in the Eastern District of Washington. So Kristen was in court, I was in court, we were in court last week arguing that case on behalf of Washington, and these other states have joined us. And that is a lawsuit that we filed against the Biden administration, against the Biden administration's FDA. So the Texas case is also a lawsuit against the FDA. So there's competing lawsuits essentially against the FDA, one brought in Texas and one brought by Washington and the other states in the Eastern District of Washington. You bet, yeah.
Any of you can,
One of the things you said about this, about why all of these multiple efforts are necessary. We have to understand we are under attack. Women in Washington are under attack from a hydra-headed beast who's coming after this right. First, they want to stop people from being able to go to a different state to do a legal procedure. Idaho wants to stop Washington women from traveling to Idaho and then being able to return for a legal procedure in the state of Washington. They want to prevent their own citizens from going to Washington to seek a legal action in the state of Washington. Idaho should not be able to criminalize what is going on in the state of Washington. We will not stand for that. Then, when they stop people from traveling across state lines, they want to stop access to a safe pharmaceutical that women have been using for 2 decades for this purpose. So they want to stop every possible means for this right to be exercised. And we're just going to have to be very, very alert, including Bob's most excellent litigation.
Jim is going to take just a couple, we have only 1 or 2 questions left, we've got a couple online.
And we'll start with Sarah. Sarah, your microphone is now available if you'd like to unmute.
Sarah, who are you with?
Sarah's with NPR. Sarah, can you hear me?
Okay, can you hear me now?
Yes, go ahead, Sarah.
Sorry, it took me a second. I just wanted a little bit more detail about the distribution question, which I know you were already asked. You said it's going to health clinics. Are you talking public and private health clinics? Will they have to take any additional steps to request the medication? Can you tell me anything more about how that will actually roll out?
My understanding is we could use both public and private as soon as this bill passes. Again, the Department of Correction has existing authority to purchase and possess this product under Washington law and existing federal law. All we need is an additional way to deliver it through prescription authority through the normal channels. So what I'm anticipating, it will be delivered through normal medical systems, both public and private. That's the current plan.
Great. Shauna Silversby with McClatchy has a question. Shauna, I have allowed your mic so you can unmute yourself and ask a question. Shauna.
Shauna, who are you with? After you unmute.
Can you hear me?
Yes.
Okay, sorry about that. I'm with McClatchy. I just had a question about the other abortion drug that is needed for abortions, misoprostol. I apologize if I mispronounced that. But I'm just wondering, are there any concerns about future access to that drug as well? And if so, are there any talks yet to secure a larger supply of that medication for Washingtonians?
At the moment, we have not assessed a risk that would justify some abnormal purchase. So it's a mifepristone that we believe there is a real risk at.
We got a wrap.
With that, I want to thank yes.
Sorry, Governor, are women coming from out of state, will they be able to have access to this stuff? Or is it just Washington?
Yes, people in the state of Washington legally would have access to this product.
And then is there taking account that women from other states will likely be coming to Washington?
So we in our purchase, we had a prediction of roughly the same level we've used. Now, if that happens, the stock would not last as long, okay? But this is roughly our best assessment of what we can do. And we thought it was appropriate to buy enough to take care of the people in the state of Washington. But we will serve others if they come. With that, be well, and let's preserve the right of choice everywhere, including the state of Washington. Thanks very much.
Thank you, Governor.
Thank you, Karen.